Dear friends, everybody realized yesterday and today how hard all of us have been working in the last year. When you see the results, I think you all agree with me, it was quite impressive.
We think that this is a unique opportunity to create a network for diabetes research in Europe. And I think that's not only important for research activities, but also for patients and subjects en route to type 1 diabetes.
Really, one of our main objectives was to develop an EU infrastructure where we could recruit or invite for participation people with type 1 diabetes or unaffected family members to participate in a novel way of gathering samples and information from them, namely to make a living biobank.
And the big challenge that we have is that we need to understand what causes disease in order to be able to treat and to prevent it.
The plan is to recruit the patients as close to diagnosis as possible, ideally within the first week. We're pretty confident we could get going probably by the end of this month.
Type 1 diabetes is an autoimmune disease, and we want to try to find a way to divert the immune system away so that we can provide some long-lasting benefits for these patients beyond just treating the symptoms, which is what insulin therapy provides.
I developed type 1 diabetes when I was 11 years of age, and I have two brothers, one older, one younger, and neither of them have ever developed type 1 diabetes, and our research tries to understand why one person gets this condition and somebody else doesn't.
And I work on the beta cell, that are the cells that produce insulin. So we are convinced that Innodia is a unique opportunity to bring together people working on both aspects of the disease. So this is about bridging.
A very important objective was also not to have data everywhere in Europe, but to bring these data together also in an integrated database.
I believe that bringing together patients actually, it's a very, very important aspect, because without the patients it's very, very difficult to create interventions that have a big impact on their life.
In this study, it's very needed to have a great number of patients participating, so they can help really in the research by joining the research centers.
And this is, of course, an additional burden to those patients who are burdened by diabetes already. But we really have to motivate patients to be part of the future.
And we think it's really important that you, as a patient, a parent or a relative, that you participate in this study. And you could participate by giving blood samples, for example.
So this is a perfect blend of the best people with the same vested goal, aligned to accelerate the development of therapies for multiple individuals affected with type 1 diabetes.
It's actually beyond just the protocol and what we intend to do. All the exchange that we are able to do actually fertilizes further our thoughts. So I believe it's of extreme importance that we step together, unify our procedures, and go ahead together.
We are a family. We need to stick together. We need to make this happen. And we is really we. We is us, all of us. So we need you to make it happen.